Hello?
Hello, I'm calling with a report on Chin-Li Zhang. You should have received a referral for in-home hospice care for Mr. Zhang from Dr. Cardinal's office this morning. Chin-Li Zhang is an 87-year-old Chinese-American widowed man. He has terminal lung cancer that was diagnosed 4 years ago with a prognosis of 5 months to live. He has been palliatively treating his cancer for the last 4 years with a combination of Western medication and traditional Chinese medicine practices. I will send over a list of his current medications and the supplements he's taking. He has begun to decline more rapidly, and Dr. Cardinal believes that he is appropriate for hospice care. He is mostly bedbound and has periods where he is lethargic and unresponsive, and he can no longer complete any of his ADLs. He is very reserved in how he expresses his pain and does not admit to being uncomfortable, and I believe he may be worried about being a burden to his family. However, he is adamant that he does not want to pass away at a hospital. In general, he's tachycardic, but his blood pressure and temperature are stable. He's been using 2 to 4 liters of O2 via nasal cannula for the last year and will destat into the 80s without oxygen support.
Okay, thank you. What is Dr. Cardinal's prognosis for his end of life?
He estimates that he has days left, possibly a week, depending on the level of oxygen therapy that you choose to use with him at home.
My name is Heather. I'm here to care for Chen-Li today. How are you?
I'm doing okay. I'm very tired. This is just such a hard process to go through and I'm feeling very burnt out. Dad is doing okay. I've noticed that he's been sleeping a lot more, but when he's awake, he looks like he's in a lot of pain, which is when I ask him, he says, "I'm fine." I know he's in pain, but he doesn't like to tell me that he is. I'm trying really hard to keep him comfortable, but sometimes he gets upset at me for being a little overbearing. It's just so hard to see him like this.
I'm sorry. Well, let's go see your dad and I can do some assessments. And then let's sit down for a while and talk about your dad and ask how you're taking care of yourself to see if we can make this process more comfortable for the both of you. Do you live here full time?
Yes, I do. This is my house. I've been working from home to keep an eye on him.
Hello, Mr. Zhang. My name is Heather. I'm your home care nurse that will be taking care of you. How are you feeling?
I'm fine. You don't all have to be here. I have lived a good life and always say my prayers. I know that Shane D will be ready for me soon. I just want to be comfortable, and I'm glad that Lily takes care of me, but she needs to take care of herself.
Well, that is a good goal to have.